Health officials say that one of the leading causes of mortality in the Philippines is pneumonia, an infection in one or both of our lungs. The most common symptoms are cough, fever, chills, and having trouble breathing. On its own, pneumonia poses a serious health risk as it attacks our lungs that basically helps us breathe well. But pneumonia caused by the COVID-19 virus is a different story. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Who are at higher risk of pneumonia? Well, these are the really young and the really old. To help us with today's discussion, joining us are Dr. Ivan Villaspin, who is a pulmonologist and the immediate past president of the Philippine College of Chest Physicians. Also with us is Dr. Jade Javier, who's an infectious disease specialist from the Batangas Medical Center. I'll start the discussion kay Dr. Ivan muna. Please walk us through some of the common symptoms kapag ang isang tao ay meron ng pneumonia.
Symptoms may vary, but the most common are cough, which may be dry or productive with greenish, yellow, or even blood-stained mucus, chills, shortness of breath, vomiting, diarrhea, headache, runny nose, loss of appetite, etc. Now, depending on the causative organism.
Are there any ways in your practice that pneumonia can be differentiated from the simple case of flu or the common cold?
So colds, the symptoms may take time to develop and include cough, sore throat, stuffy nose, sneezing, watery eyes. Usually there's no fever. Then the flu, the symptoms, they hit fast and often include extreme fatigue with body ache, muscle ache, loss of appetite, headache, high fever, chills and sweats, stuffy nose again, and coughing. These three conditions can overlap. So yung sinabing flu, before the COVID, yan yung trangkaso. Ngayon pag sinabi mong tinatrangkaso ka, now you have to seriously think of COVID.
Dr. Ivan, kapag merong pasyenteng pumunta sa'yo with possible pneumonia, are there any tests that you perform para to confirm the infection?
We base it on a good clinical history. Dapat magaling ka kumuha ng kwento, chismoso ka dapat. And the focused physical examination of the chest or the lungs. Now, we ask about the patient's the recent symptoms, the environmental exposure, the past health problems, smoking history, especially, and comorbidities such as diabetes, hypertension, asthma, kidney disease. After which, we request for diagnostic workup such as the chest X-ray, where we look for certain X-ray patterns which can point to a possible bacteria or virus as a cause of pneumonia.
Now, the more common causes among Filipinos are viral and bacterial. I'll go now kay Dr. Jade. Let's explain to the viewers, ano ba yung difference ng viral and bacterial kung pneumonia din pala ang mangyayari din dito?
If we base it on the symptoms themselves, bacterial and viral pneumonias really have overlapping symptoms and even signs. So, pareho silang pwedeng magkaroon ng ubo, sipon, lagnat. But for viral pneumonia, sometimes they really start as a simple viral illness, just like the flu. So first, they may come out as body weakness, muscle pains, colds, and sometimes even sore throat before patients develop cough and difficulty breathing.
Is there certain characteristics of a cough ng isang taong infected na with pneumonia? Pagpasok pa lang ng pasyente, pinaubo mo yung pasyente, is there a certain characteristic na alam mo nang, parang pneumonia na to?
Iba-iba po ang klase ng ubo. And sometimes, especially in the elderly and those in the extremes of age, some people with pneumonia might not really manifest that much with cough. Some elderly populations, hindi naman masyadong maubo, but when you do some tests, you examine them, they have signs of pneumonia. So if we are to base our diagnosis and the cause of pneumonia on the cough, I don't think that will be a very, very accurate measure. Iba-iba po talaga.
Let's start first with the viral pneumonia, which as the name implies is caused by a virus. Now, the common cause is the flu or ang trangkaso, but you can also get it from common colds and other viruses as well. Dr. Jade, apart from it being caused by a virus, what other cues indicate that this type of pneumonia is viral and not bacterial in nature?
A lot of things overlap between bacterial and viral pneumonia. But let's say COVID, for example. No?
Right.
It's one of the most common viral pneumonias that we have right now, even more common than influenza. No? Well, some clues will be sa imaging studies. So there are major differences in imaging studies, or when we say imaging, no, for the lay, X-rays or perhaps CT scan. So there are differences, but are not absolute differences between bacterial and viral etiologies. And we can also refer to some of our tests. Like, for example, if we request for a CBC, that's a basic laboratory test. It's a blood test. If we have bacterial pneumonia, we expect an increase in the WBC count. But if it is a viral type of pneumonia, we expect a low or probably a normal WBC count. These are just a few clues for us to differentiate, but there are other special tests that we can do, such as PCR and some multiplex PCR tests that are available especially in the tertiary institutions, that can help us differentiate the etiologies.
Now, most people who get COVID-19 have mild to moderate symptoms, but some can get severe pneumonia in both lungs. Dr. Ivan, pag-usapan naman natin to. How does pneumonia develop in people with COVID-19?
Not all patients with COVID-19 will develop pneumonia. Not all of them. So in fact, only the moderate, the severe, and the critical cases are associated with pneumonia, regardless of whether they are young, old, previously well, or they have comorbidities. No? Pneumonia usually would start after more than a week from the onset of the patient's symptoms. Okay, the illness starts with the inhalation of the virus, the SARS-CoV-2 virus, and travels from your nose, your mouth, down to the airways, to the air sacs we call alveolus, where the spike protein of the virus will attach now to the ACE2 receptors, present in many parts of our body and the vessel wall, causing an inflammatory reaction.
We'll discuss how pneumonia affects people from different age groups. We're your connection to healthcare, and you're watching MedTalk Health Talk on CNN Philippines. Up next, we'll talk about how pneumonia affects different age groups and how to treat and prevent it. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. We're together in health. Now, before we go into that, I'd like to ask Dr. Ivan, when it comes to pneumonia ng COVID-19, are the symptoms similar?
Whether it's dry or productive, cough, fever, and labored breathing or difficult breathing. When you're given that triad and then you listen to their chest and you listen to crackles, that's pneumonia. Then we call that community-acquired pneumonia. Now, let's talk about COVID. Now, during this time, given that same triad, the burden is on you now to rule out COVID pneumonia. Patients will complain of loss of smell and loss of taste. Now, when you hear that, those two symptoms, we call it now a COVID probable. So while the chest X-ray may seem normal, the chest CT scan will reveal the distinct, what we call the ground glass abnormalities. That's only noted on the chest CT scan very clearly.
Because they say that this pneumonia is more common in the really young and the really old. Dr. Jade, why is it the case? What is it about the really young that makes them more predisposed with pneumonia?
So for pneumonia in children, a few factors that come into mind will be, of course, number one, the maturity of their immune system. Mas marami silang mas hindi pa sila exposed, no, sa mga most common types of bacteria or viruses that us adults have already been exposed to, and therefore we are already immune to those types of bugs.
One of the best ways to prevent the disease is taking a vaccine that is available for that. And there is a vaccine available for preventing pneumonia. Now, Dr. Ivan, is taking the vaccine for pneumonia a good preventive measure given to the old, definitely? How about for the young?
You need to get a flu shot every year to prevent seasonal influenza. The flu is a common cause of pneumonia. So preventing the flu is a good way to prevent pneumonia. Okay? So for protection against certain bacteria that can cause pneumonia, we follow the CDC, the Center for Disease Control, USA, which recommends two pneumonia vaccine. The pneumococcal polysaccharide vaccine, okay, or the PPSB23, is recommended for adults 65 years and older, and anyone 2 years and older with an underlying condition that may increase the risk for pneumococcal disease. The pneumococcal conjugate vaccine, which is the PCB13, is recommended for adults 19 to 64 with immune-compromising conditions such as chronic disease of the heart, the lungs, the liver, the kidney.
Now, Dr. Ivan, punta naman tayo sa treatment. How is pneumonia treated in adults, especially those, katulad na minention ni Dr. Jade, adults with comorbidities, and how can this be prevented?
Usually, pneumonia can be treated at home, but in serious cases, it may require a hospital stay. Now, these management principles I just mentioned are intended for the regular pneumonia that we're talking about, but not necessarily for COVID pneumonia.
Okay.
Apparently, there's a wide variability in the prescribing behavior of the doctors or even the specialists, notwithstanding the availability of local and international guidelines. For example, our Living COVID-19 Philippine guidelines, of which I'm a member, we recommend against the use of azithromycin, very popular now, among patients with COVID-19 infection. We have a moderate quality of evidence and a strong recommendation for that antibiotic. Yet, we observe a large-scale abuse and misuse of this antibiotic. That is the driving force behind the concept of antibiotic stewardship. I'm not saying that we should not give antibiotics to patients with COVID pneumonia. Rather, we should be mindful in the judicious prescription of antibiotics, Freddie.
Dr. Jade, how effective now, almost 2 years into COVID-19, how effective is the treatment now for COVID pneumonia?
I can say that relative to our experience before all of these treatment modalities have been present, no, certainly the outcomes of our COVID-19 patients have significantly improved, given the number of options that we have right now in terms of monoclonal antibodies, antivirals, and other procedures that are options for treatment of COVID, especially for those who have severe to critical infection. But since we are talking about treatment, not all COVID patients need antibiotics. Let's remember that COVID is caused by SARS-CoV-2, which is a viral, it's a viral infection, and antibiotics do not have a strong role unless there is strong suspicion by the doctor that there is a co-infection, no, aside from the viral infection. So it shouldn't be a knee-jerk response na, oh, may COVID, bigyan natin ng antibiotics. No, hindi, they don't have a role on the treatment, general treatment of COVID-19.
Okay. Now, when we return, we'll talk about how pneumonia affects the elderly. We'll also discuss some of the prevention and treatment methods available. Your health is our mission, and this is MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care always comes first. Filipinos over the age of 60 are among the age groups with the highest mortality rates due to pneumonia. And one type that can affect seniors is called aspiration pneumonia. Dr. Ivan, discuss natin with our viewers, what exactly is this at paano nangyayari ang aspiration pneumonia?
In general, when we say aspiration, it must be pointed out to our listeners that we do aspirate. We probably aspirate about 30 ml of fluid every night, when we sleep. Aspirate, bumabalik yung pagkain natin sa tiyan, pupunta ng baga natin. But it doesn't cause significant disease in many people, except for patients who are, you said, elderly. So and that's difficult, and it's a challenge to manage aspiration pneumonia, you're not only thinking of gram-positive, gram-negative, anaerobic organisms, and which means you will be given expensive medications, no? So aspiration pneumonia is something that can be actually prevented, no? Kasi aspiration pneumonia may be witnessed or unwitnessed. Many times unwitnessed, hindi mo nakikita yan. Witnessed, yung nagmamadali kang pinapakain mo yung tatay mo, yung lolo mo. O di nag-aspirate yung si tatay, si lolo. Yeah, these are things that has to be emphasized to our patients.
What are some of the symptoms that people may see on the elderly? Could this be one of the causes why some of the elderly may fear of drinking water or eating food because ang pakiramdam nila nasasamid?
For some people who are healthy, the body will mount a defense. So lalagdatin yan, fever and even chills. For some people who are not competent, immunocompetent, they're compromised, immunocompromised. Sometimes they don't mount a defense, so walang fever. Kaya ang fever ay isang senyalis siya ng maganda, nag-defend you, nagpuput up ng defense ang body mo eh. So those are the symptoms.
Dr. Jade, I'd like to go to ask you, how difficult is it in treating pneumonia in that of the elderly, and how important is it for preventionary measures, the vaccines and things like that?
In general, it is often more challenging to treat the senior citizens. Why? Because of the comorbidities that they usually have, the immune system status that they usually have. And I often tell this to my patients that our antibiotics, our treatment, it's only half of the process, and a good half or part of the influence of treatment success will be really dependent sa katawan mismo ng pasyente. No? So most of the time, these elderly patients are also prone to have multi-drug resistant organisms. Mm-hmm. Why? Because minsan sila po yung pabalik-balik na sa hospital, so they have recurrent hospital exposures, antibiotic exposures already. So minsan yung pong mga mikrobyo na meron po sila, mas matatapang na rin kumpara po sa younger individuals who haven't received any antibiotics before. If we can prevent pneumonias in the elderly, that would be the best way to go. Vaccination is one. So the pneumococcal vaccine and the influenza vaccine, it wouldn't necessarily mean that it prevents infection, but once patients develop pneumonia, it may not be as severe. Okay. They may not need hospitalization and they may not need ICU admission. So isa po yun sa benefits ng pneumonia. We have to make that clear na hindi naman porke nabakunahan ka na, hindi ka na magkakaroon ng pneumonia, but it can be in a milder form. And that's really a big plus to get vaccinated.
Dr. Ivan, if there were 3 things that you would like our viewers to learn about pneumonia, what would they be?
The tips to prevent pneumonia will be, remember to incorporate these 5 habits into each day. Number 1, stop smoking. Number 2, you exercise regularly. Number 3, reduce your exposure to pollutants. Avoid your infections. How do we do that? You drink a lot of water, hindi soft drinks. Hindi po tubig ang soft drinks. You take your multivitamins, as mentioned by Dr. Jade, and breathe deeply. Magano ka? Breathing exercises. So by focusing a little of your energy on this task, these 5 tasks that I mentioned to you, you can help keep your lungs working optimally for life.
We hope you found our discussion today very helpful. Thank you to our esteemed guests, pulmonologist Dr. Ivan Villaspin and infectious disease specialist Dr. Jade Javier. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines.